This time I want to concentrate a little bit more on the tangible physical body. And I'm going to show you some exercises which I consider helpful in relieving pain and around our hip and in our pelvic area. And in my opinion, the pelvic area is very important for the whole body. It's where originates almost every movement we do. We move our lower extremities from our hips, and we move the whole upper body from our SI joints, from our lower back, and along the spine towards upper extremities, neck and head. So the pelvic area is very important, and often we do have a lot of patients of mine uh, have their pain in the groin or in the backside where the SI joints are. And so I think it might be helpful to figure out some easier exercise which you can do to relieve the pain. And so the exercises are not any specific scientific physiotherapeutic methods. They are just easy movements which everyone can do. And if you cannot do in the way I do it, then do it just in some form. And it is helpful for yourself, for you in the range of motion you have. In so just listen to your body, listen to your pain, and be aware of it. That's the most important part. That we follow the pain, that we are in the interaction with the pain, we communicate with the pain. And so I'll show you some way of doing it, and you do it your own way, but try to keep the thought, the idea. Yeah, so I'm going to focus on the hip area specifically today because it's important part of our body, and there originates a lot of pains of ours. So you lie down on a bed and you bend your knees, and you do circles with your calves, with your feet. And this movement, which looks like you're moving your shins, you're moving your feet, but actually the movement starts in your hip. And so this easy movement rotates the whole femoral bone and the thigh. And you can do the circles like symmetrically, or you can do it like this way. And of course you don't look somewhere there like I do. I lie down. And of course breathe. This is a great exercise to balance the rotators of your hip, your glutes, and your adductors, and do it in whatever way you can. Little circles, big circles, You can do it even this way. This is a little bit more difficult. But one way, another way, another round. And what is important, you try to do the movement consciously. You try to make it as smooth and as round as possible. So sometimes in some area it's for those muscles more difficult because they are in some tension and they are in some imbalance. And so where you feel that the circle is not, like for me it's here, here I I lose the smoothness. Here it's okay. But here my muscles are not balanced enough to make it smooth around, to make it smooth circle. And so if there is problem, if you feel that it's like jumping, then slow down. If you do it slowly, if you give the muscles time to adapt with the tension, then you will teach them the memory of the movement of the tension. And next time is going to be easier. It's very, very good for your SI joints also. Another exercise. Just lie down and move your legs like this. And relax. This movement also moves your thighs, your femoral heads in the joint, in the hip joint. It rotates inwardly and outwardly. And when you do it like this, relaxed, then you stretch, you alternate the stretching and the tightening. You stretch your capsule also. So if there is any tightness in your groin, this can really release the tension. Keep doing it for a moment. You can feel that when your leg is in some position, it might be in the external rotation, or for someone it's in the internal rotation. You might feel some tension, some tightness and pain. So that's good, then do it. Move around the pain, around the place where you feel it. This body awareness is the most important. You need to feel your body, to do what is helpful for yourself, not to follow any rules, like any exercises which anyone taught you, but do what you feel it's good for yourself. Try to make your your legs really relaxed. You need to pull a little bit inwards in your internal rotation to make the movement happen. But you you pull and then you release, pull and release. And stretch your back. One side, another side. That's the easiest. That's very easy stretching for your lower back. But if you have any pain there, find it. Find the pain, find the position of your legs, of your back, of your trunk, where it stretches, where it hurts, and calm down, relax in it. Find the pain and be with it. Breathe. I feel some tension in my lower back on the left side right now. So I feel the tension here at, in this position. So I stay in it. I breathe in and I relax with the breath out. And if you have the pain in your back, you can hold your knees and push a little bit against your hands. Stretch your back. And you can move in this stretching also from one side to another. You can move in sagittal direction also. And you can even do the circles. This is a little bit more difficult. It's easy, you just lie down and you hold your knees. The majority of people should be able to do this. And if this is too difficult for you, then do just a little circles. Hold your knees and do whatever your body allows you to do. But try to focus on the smoothness, on the circularity. And then I like to hold my feet like this and move. And you can do the stretching in this position also. in which position you find your contraction. Find it and stay there and breathe. Roll from one side to another. Or stretch like this. Just hold your feet. Most important is if you feel any tension, just work with it. Don't let the stiffness stay in your body. You can move, you can release the tension. But sometimes you have to do it. And just if you let it be, the stiffness is going to win. So hold your knees and do the circles with your knees in a frontal plane, as a plane of your chest. So do the circle like this with your knee, which means you do the circle with your thigh and with your femoral head inside the acetabulum also. So if you do the circle with your knee, you actually exercise the rotators of your hip. They need to be balanced. And again, you can do one, the other, both together or asymmetrically. What is important, try to focus on the smoothness of the circle. If you can see, my circle is right here, and at this position it's a little bit difficult for me. So when I do the circle around, it's okay, it's smooth, it's circular. And now here I need to slow down to make it as I want, to make it smooth and circular. It means that the muscles inside are working properly. If I'm too fast, they don't have time to adjust. And yeah, so I do it like this. And you can do it with your both. And this is also very good for your lower back, for your SI joints because this is alternating movement. But this is a little bit more difficult. You need some belly muscles for this. But if it's too difficult for you, you can hold your knees and you can do just little circles. But when you do one side, then the other side, and you are actually moving from one pelvic bone to another one, actually from the iliac bone, from one SI joint to the other SI joint, and you do the movements, then this is also very good for balancing the tension in your SI joints. And as you probably know, there is something what's called muscle chains. Our muscles don't function in the separate way. They connect in some longer chains of muscles which work together. And there are different systems. There is the back and front longitudinal system, there is the lateral system, and there is like the spiral system, which goes from one side to another, to the opposite. And so we use this in our locomotion, in our movements. And so from sports like climbing, we know that to be most effective, to do the movement with the highest strength possible, we need to connect the chain, the full chain. So it starts from our toes and goes through the leg, along the leg, and through our pelvis and our abdominal muscles to the other side, to the opposite arm, to the fingers of the opposite hand. And when we connect this way, then we are most powerful to create the movement, to stretch to another hold. And so this is very important to understand that our body functions the best when we have this crossover, this X pattern. And those forces, they actually change from one side to another in the area of our abdomens and our pelvis, around our pelvic bone and our symphysis. There is a big concentration of those opposing forces, and we can use that. The body awareness is the key to contact your illness. Without the awareness of your body, of your condition, there is no way around. There is not possible that the information which the condition brings is actually delivered to your consciousness, and without it being conscious, it's almost impossible to change it. First of all, we need to bring it from the subconscious to our consciousness, and it means also it's not only the subconscious of our mind, it's somehow subliminal perception of our body that we do feel some discomfort, but we don't really we don't really focus on what it really is. And I think that is something what we need to do. Uh, when I have some problem, some pain, I need to I need to check my body, to check it really with my hands, with my awareness, with my consciousness, with my movement, to figure out where is this imbalance, where is this discomfort, what can I actually approach? Because when we leave it just like being, somewhere pain in my back or in my shoulder or wherever, and we don't really try to find out, to really observe, to really figure out and find where the problem is, then we are stuck. There is no possibility to do anything with that. So the body awareness, to check out, to find where the problem is very important. So let's do it. Let's scan our body. You don't need to try hard. It's not that if there is nothing, you need to find something. No. But if there is some imbalance, your body knows it. And it knows it subconsciously, it knows it intuitively. But you need to give it the opportunity to express, to manifest, to be observed. So when you allow it to be observed, you allow it to be seen, then there is always something what just pops up. It's something what's prepared to be seen. And so you don't need to dig really deep. You need to open and to stay still and wait what's gonna happen. So do it. Observe your body. Observe where is the discomfort, where is the pain. Touch it. Find, really find a place. And it can be one spot, and it can be the whole chain of muscles which is in tension. And of course, it can be some organ or whatever. Just find it, check it out.